much, and I now call George Adam to be followed by Margaret McCulloch.
Thank you, Presiding Officer. The Scottish Government's ambitious plans for person-centred healthcare is welcomed. The Scottish Government introduced the Healthcare Quality Strategy in 2010 and the 3 key points of safe, person-centred and effective. And today's debate is more about the person-centred part of the whole scenario, mutually beneficial partnerships between patients, their families and those delivering healthcare services. And I think that's much with what Nanette Milne was talking about previously with regards to the days gone by where health professionals actually talked about individuals instead of talking to them with regards to some of the complaints, and it's something that people have obviously had complaints with in the past. And I think this is a good way to actually make sure that we do. You know, it sounds like some new age form of language talking about person-centred healthcare, but as Mr Finlay quite rightly said, it says what it does what it says in the tin, and that's the most important part about this whole kind of thing. One of the things that Bob Doris brought up as well was the fact that he believed that a good example of this was self-directed support. And I would agree with that as well, because I think that gives individuals the independent living that they all strive for. In years gone by, I worked as a councillor and I was a member of the Renfrewshire Access Panel, and the number of times that, as the council's representative, the debate would not be about access issues or mobility issues, it became about health and social care issues. Now that made me decide that it might be a good idea to have a Renfrewshire Disability Forum that crossed all forms of disability, and they had access to health and social care professionals and workers at a senior level so that they could actually make a difference in their local area. And that has worked, because now I heard at the last meeting we went to, they actually spoke about access issues and they were doing the jobs they were meant to be doing, and they left that for the Disability Forum. And I think that's about the empowerment. It's making it person-centred and making sure that they get the opportunity to actually be able to see what their problems are and what their issues are. Yes, Mr Finlay.
Neil Finlay.
Maybe if I could mention the other side of self-directed support, where people who are coming to us are telling us that they are part of third sector organisations who provide person-centred support. Their organisation wins a contract, but they can't win it at the level that they won it the last time they tendered. They therefore put in a lower price, they win the tender, and what happens? The day after they win the tender, they are told that for the 6th year in a row their wages are frozen and they're working 2 hours further a week. What does that mean for the quality of care that's being provided?
George Adam.
Well, I would make sure I'm talking about the right debate when I say things, Mr Finlay. That's more a procurement issue than it is to actually talking about the person-centred debate that we're having here today. This is about the individual and actually making sure that we can actually deliver the kind of centre approach that they want. And I would suggest that you probably bring that up at a later date when we do actually talk about procurement. But, you know, people wouldn't be surprised if I'm talking about person-centred healthcare that I mention multiple sclerosis, because obviously everyone will be aware my wife Stacey has MS, as do Scotland. We have more people per head per population than anywhere else in the world. And this year they had the Lottery of Care report, which we obviously discussed in this chamber during MS Awareness Week. And it showed that, you know, there was things that in Scotland we were particularly good at, and there was things that we still need to work on. And that was the positive thing about this, is after that debate, the MS Society wanted to work with ourselves to create a cross-party group for the first time in this Parliament's history, to actually work with the Parliament, the Government and everyone else to actually see what we could do to make things better, so that we don't come every year where there's an MS Awareness Week and we've got a list of complaints. We're actually working with the Cabinet Secretary and others within the profession to actually make a difference and make sure that we're not just shouting from the sidelines. We're actually taking an active approach in the process. And I have to say that MS in particular is a condition that's specific to the individual. Every individual is individual, and this type of policy, this ideal, is perfect in action for someone who suffers with multiple sclerosis, because it means that you're dealing with them as, I think it was the quote that the Minister used was the fact that they were talking to them about a person as opposed to the condition. And I think that's the thing we have to remember, and we have to make sure that we listen to the individual and we don't just look upon them as a diagnosis or a condition. You know, regardless of the conditions, there are so much things that we can actually do. Keeping people healthy within their communities is one of the things that's probably really quite important. Earlier on in the year, my mother was diagnosed with cancer and eventually died. But during that period, we obviously looked at the idea of, at one stage, it was a year or 2 years, that she would have an opportunity to be at home. And our plan was going to be actually make sure she was with her family, within the community, making things better. Now, things didn't work out for us because things got worse for her health during that period. But I think that's obviously, when you're looking at the person-centred, of course, when you're in that type of situation, of course you have to look at the family and make sure that they are actually within their own family and their community at these difficult times. But one of the other things is, it's not just financially prudent, it's it's actually the right thing for us to do as well. We face, as been mentioned a number of times, a lot of challenges with regard to our ageing population, and the health and social care integration for adults will help with this, because I think some of the situations we've had in the past has been, I think Siobhan McMahon mentioned, that situations where there was not a join-up in communication or linking, where there might be an elderly person coming out of hospital to try and get home and the care wasn't available, it wasn't there. I think health and social care integration will give us the opportunity to make sure that we can give a complete, rounded service for these people and these families in these conditions, because that's what we have to do. We have to have had times in the past where we've had to intervene as politicians to do that, and that should never happen. It should never get to that stage. It should always be part of the service as well. One of the other things is the Scottish Government has protected the health budget. So I was listening to some of the things that Mr Finlay said, and it's not the NHS that I recognise, and it's not the NHS that is actually out there. And it probably is a negative thing, the way he talked about some of the workers within the NHS in Scotland as well. My wife obviously has MS and she's a long-term condition. Other people who are genuinely engaged on a regular basis with the NHS don't recognise Mr Finlay's ideal or his belief of what the NHS is. And I think the Scottish Government is to be commended that they've been investing money in the NHS has been a priority. Like the rising to a record of £11.8 billion in the resource budget in 2015-16 just tells you exactly how important that this is to the Scottish Government. So I would just say, Presiding Officer, the NHS is how we care for our people, defines who we are, and the Scottish Government has shown a commitment to this, and the person-centred approach is much welcome. If we do not support the people who we serve, then how are we relevant to them in the long term? I support this initiative and applaud the Scottish Government on their continued support of our National Health Service.
Thank you.